If you think Medicare pays most of your healthcare bills in retirement, that belief alone could cost you over $170,000 you didn't budget for. I'm Margaret Hale, and after 30 years helping people navigate Medicare and pensions, I've heard the same comforting myths over and over. Today, I'm busting four of the biggest ones about retirement spending using real 2026 numbers from Social Security, Medicare, and the government's own household spending surveys. This isn't about scaring you, it's about replacing guesswork with facts so you can plan with your eyes open, because getting these numbers wrong doesn't just mean an awkward surprise. It can mean running out of money at 80 instead of 95. Let's look at what people believe and what the numbers actually show. Myth number one: Medicare covers most of your healthcare costs once you retire. It's an easy myth to believe. Medicare is often talked about like a full health plan that kicks in at 65, and the premiums you hear about sound manageable. What most people don't realize is how many pieces of the healthcare puzzle Medicare simply doesn't touch. It doesn't cover long-term custodial care in a nursing home. It doesn't cover most dental, vision, or hearing costs. And every part comes with its own premium, deductible, and coinsurance that adds up fast. When you only picture the monthly premium, the real cost of healthcare in retirement looks a lot smaller than it actually is. Here's the reality. The standard Medicare Part B premium jumped to $202.90 a month in 2026, up from $185, a 9.7% increase in 1 year. On top of that, the 2026 Part B deductible is $283, and the Part A hospital deductible is $1,736 per benefit period. If your income is higher, Medicare charges an extra IRMAA surcharge, pushing some people's Part B premium as high as $689.90 a month, though only about 7% of beneficiaries pay it. Add it all up, and Fidelity estimates a single 65-year-old retiring today needs about $172,500 saved just for healthcare costs in retirement. Yet the average American expects to spend only $75,000. What to do? Treat Medicare premiums and deductibles as a fixed monthly bill in your budget, and compare Medigap or Advantage plans every fall during open enrollment. Myth number two: the average Social Security check tells you what you'll get. It's easy to see why people believe this. News stories quote one number, the average benefit, as if it applies to everyone equally. But Social Security benefits are built entirely around your own earnings history and the age you claim. Two people with different work histories or who claim at different ages can receive very different checks, even if they retire in the same year. The word average hides a huge range, from people who claimed early with modest earnings to people who waited and earned the maximum. Treating that single number as your number is one of the most common retirement planning mistakes I've seen in 30 years. Here are the real numbers. The estimated average Social Security check for January 2026 is $2,071 a month, rising slightly to $2,081.16 by April, thanks to a 2.8% cost of living increase that reached 75 million Americans. But your full retirement age is 67 if you were born in 1960 or later. Claim at 62, and your benefit is permanently cut by about 30%. Wait until 70, and the maximum possible benefit reaches $5,181 a month, though most retirees collect far less than the maximum. If you're still working while claiming early, 2026's earnings limit is $24,180 before benefits start being withheld. What to do? Log into your own account at ssa.gov to see your personal estimate, not the national average, and talk with a licensed advisor before deciding when to claim. Myth number three: the average retiree spends about $5,000 a month, so that's roughly what you'll need. This one feels trustworthy because it comes straight from government data, the Bureau of Labor Statistics, tracks exactly what retired households spend, but an average blends very different households together. Healthy, mortgage-free retirees traveling on a fixed budget, and retirees facing major medical bills or nursing home costs, all folded into the same number. That blend can make the typical retiree look far more comfortable or far more strained than your own situation actually is. A national average is a useful starting point for planning, but it is not a personal budget you can simply copy. Households age 65 and older spend an average of $61,432 in 2024, about $5,819 a month, actually the lowest average spending of any age group tracked. Narrow that to ages 65 to 74, and average annual spending rises to $65,344, about $5,246 a month. Where does the money go? Housing is the single biggest slice of any household's budget at 33.4%, followed by transportation at 17%, food near 13%, and health care at 7.9% of the average budget, a share that climbs higher for retirees. What to do? Instead of assuming you'll spend the average, build your own line item budget using your actual housing, transportation, and healthcare costs, then compare it against your expected income. Myth number 4: long-term care won't happen to me, or Medicare will step in if it does. It's a comforting thing to believe because nobody wants to picture themselves needing help with daily living. And there's real confusion here. Medicare and Medicaid sound alike, but Medicare does not cover ongoing custodial nursing home care. Only Medicaid does, and only after you've spent down most of your assets. Because this topic is uncomfortable, many people simply skip planning for it altogether and hope it never comes up. But the numbers say otherwise, and they're worth facing head on before you need this kind of care, not after. According to Fidelity, an individual who reaches age 65 has about a 70% chance of needing long-term care services at some point, and the costs are steep. The 2025 national median for assisted living is $6,200 a month, or $74,400 a year. A semi-private nursing home room runs $315 a day, about $114,975 a year. A private room reaches $355 a day, or $129,575 a year. Even staying home with paid care isn't cheap. Non-medical caregivers cost a median $35 an hour, which adds up to about $80,080 a year at 44 hours a week. What to do? Talk with a licensed advisor now about long-term care insurance or a dedicated savings plan before a health event forces the decision for you. Let's put it all together. The average Social Security check for 2026 is about $2,071 to $2,081 a month. Average household spending for retirees 65 and older is $5,119 to $5,446 a month. That gap, often $2,000 to $3,000 a month, has to come from savings, a pension, or part-time work. Housing and health care are the two categories most likely to blow up that gap unexpectedly, so they deserve the most attention in your planning. None of these 4 myths are meant to scare you. They're meant to replace comfortable guesses with real numbers, so your plan matches your actual life. If you want help mapping these numbers against your own deadlines, download our free retirement deadline checklist. Link in the description. And if this helped, consider subscribing for more clear, no hype retirement guidance.